building a better Bay Area for a safe and secure future. This is ABC7 News.
Hi there, this is Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 to get answers for you in real time. So there's been a lot of COVID news today, statewide and locally, including the possibility of sports, salons, and churches reopening as early as the first week of June. So let's begin with the mayor of San Francisco, London Breed, today as the city enters phase 2 reopening today. So post your questions for the mayor on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. Mayor Breed, thank you so much for joining us today.
Hello, good afternoon.
Good afternoon. So it is good afternoon because some big news that I think a lot of Californians and Bay Area residents were hoping to hear, which is today Governor Newsom announcing that we may see some of those things resume in a few weeks. Hair salons, pro sports without fans, and religious gatherings. Things previously labeled as stage 3, I think. So how do you feel about that?
Well, I'm hopeful, but I want to be clear that we are, although coordinating with the governor's office, we have to use the data here locally in San Francisco to make a determination as to whether or not we can move in any of those phases. In fact, I did a talk with Dr. Grant Koufax of the Department of Public Health, really explaining the 5 criteria that we are going to be looking at to determine what phase we can go in. Right now, effective today, we're in phase 2A. There's 2A, there's 2B. 2A allows us to open non-essential businesses for retail. And manufacturing and warehouses with our social distancing. But 2B is a part of allowing people to go into some of those retail locations. And we're not there yet. Phase 3 is the hair salons and the churches and other places. And everything that we do is controlled by what the latest numbers are. And so we're proceeding with caution, and I am so hopeful and optimistic because of the people of San Francisco, we've gotten this far. So I'm hopeful that people will continue to obey social distancing, to wear masks, and to continue to follow the orders that are put out, and that will give us an opportunity to expand this because hopefully we'll see the numbers continue to decline.
So even if the state says those things are allowed to resume, the hair salons, the sports without fans, et cetera, do you think in all likelihood San Francisco would be a little bit later entering that stage, so not necessarily early June? Do you think?
I think it's very likely that based on where we are, and again, we have seen a slight decrease in the curve, which is absolutely amazing, and it's hopeful. But we cannot get comfortable with that because as some of the data also shows, we can also see that number spike just as quickly. So again, we're doing a great job, and the likelihood that we will get there sooner rather than later is contingent upon all of our behavior. So I don't think necessarily we're going to be there as of June 1st. But it's looking better than it's looked in some time, and so I'm hopeful about the future.
Okay, possibly a little later than the state. Are you in talks, though, with the Giants? Have you seen their reopening plan? How about the Warriors?
Well, we're looking at all the different plans from not just the Giants and the Warriors, and we're working with our Department of Public Health to review those plans, but also hair salons, large-scale events, small locations. And so I think the goal is to make sure that even though they may have plans that they are proposing, we are going to have requirements as people are able to open. So we want to make sure that the two of those things, are working together for the benefit of protecting public health. We've made a tremendous progress in this fight against the coronavirus, and the last thing we want to do is go backwards.
Sure. All right, before we get into stage 3, though, you have stage 2B. I love the way that you categorize them, right? We're in 2A. So phase 2B would be, I guess, shopping in the stores, childcare for everyone, not just the essential workers, and offices reopening. How long, realistically, do you think before we see those things happen? What's your best guess?
Well, today, Dr. Koufax and I had a few discussions specifically about this, like when can we expect, for example, the childcare or the summer camps or, phase 2B. And he basically made it clear that if things continue with what we've seen in terms of decreasing the curve, we can expect that somewhere around June 1st, anywhere between 2 and 4 weeks, we should expect to see transitioning into a new phase. So they look at the data and they make a decision, and we work together. And the goal is to be as creative as we can and as flexible as we can, because we want these, I'm sure you know, I want these places open sooner rather than later. I want to get our economy going as quickly as possible, but I want to do so responsibly. And so we have our fingers crossed. I am hopeful. It's not just because I am dying to get, into the hair salons or the places that we all know and love.
Mm-hmm.
It's because these businesses will possibly not even return the longer we're out, the longer the businesses are closed. The fact that they're not making any money,
Mm-hmm.
they won't be able to pay their rent and their bills and the other things that they need to survive. So I'm very concerned about how long this has taken, but I'm hopeful and I'm optimistic about the future based on the numbers.
All right, Mayor, I want to bring in some viewer questions, and we have many for you. How about starting with, are all restaurants going to reopen as part of phase 2? I mean, granted, it's their choice, but would you allow that in phase 2?
I think that we are looking at restaurants even now, like restaurants can do delivery and takeout, and we want to make sure that we're looking at a couple of things to help prepare them. Of course, the criteria around wearing masks and around socially distancing, we want to set them up to succeed. And I'm hopeful, but it's not certain.
Mm-hmm.
Ultimately, it's up to our public health department as to whether or not we'll allow them to open so that people can then dine in. And that's going to take a whole set of criteria that's going to be required.
All right. Alexander Lawrence wants to let you know he feels we need museums and libraries, Mayor, not sports and bars. So any sense for when those can reopen?
Well, I think we need libraries and all of that, and we need the bars. So I think I have been pushing on the museums and the libraries, and I'd like to see those places open sooner rather than later. And again, I know that the public wants to hear a date. And what we try to do as soon as we have a date, as soon as we have direction, based on the data we provided to you. We are working now because we do have criteria around museums specifically. We'd like to get those open sooner rather than later because not only are they spacious in many cases, but you're not really touching anything.
Mm-hmm.
So the opportunity to do that sooner rather than later is something that I am hopeful. So hopefully we'll get there, but I'm not opposed to opening the bars either.
We have 30 seconds before we take a short break, but somebody wants to know, why hasn't San Francisco opened tennis courts like other Bay Area counties? What's different about San Francisco, say, compared to Marin?
I think I'm not a doctor, but I think there was some concern, and it's not to say it's not going to happen, about the fact that the ball is being, if you're playing your household, it's one thing, but if you're playing other people, the touching of the ball somehow is problematic. But we are working on looking at that as a possibility, because I do think that some of our recreation space should open up and we should start to get a little bit more flexible. And as Dr. Colfax talked about earlier today, the more we see the numbers decrease, the more we'll be able to allow people to move around in various capacities. So we're looking at everything. And as much as we can get open, the sooner the better. Trust me, I am right there with the people of San Francisco and wanting to see more available to all of us.
All right, Mayor, let's continue this conversation on our live stream platforms, but we'll take a short break on the air.
We are in commercial break.
All right. For folks who missed it, Mayor Breed did not only partake in a conversation with Dr. Colfax and also Susan Phillips, but you actually moderated that as well. And I was so impressed that I was thinking you should fill in so I can have a day off here, Mayor. You can moderate.
I have too many jobs right now. I'm good.
All right. I'm just putting out the invitation, okay?
Oh, well, part of it is just think about it. I want to know these things too. Like, I want to know what's going on. Just pretend I'm not mayor, right? How would anyone who isn't mayor in the mix of what's going on, what do you want to know? You want answers. What am I going to do about my kids? What am I going to be able to, how do I plan for the future? Everyone wants to plan for the future, but the biggest challenge we have, as you know, this is a fluid situation. So today we could open up all shops for a particular reason, and then all of a sudden there's an influx, and then we're back to square one. So I think that's the real challenge here with this whole situation, making me crazy.
I think it sounds like we both enjoyed this aspect of our job, which is we get to talk to experts and learn things, which is cool. All right, I want to shoot off a couple more questions for you from our viewers. What do you think about teaching special education classes outdoors in the football or on the soccer fields?
I think that we need to get creative about opportunities to provide whatever we can, whether it's teaching outdoors and education in any capacity to our young people. If that is possible, we should do it. So we got to get creative, and this is my pushback oftentimes with our public. Oh.
30 seconds.
Okay, 30 seconds, one more
I
question.
thought we were on the air.
Oh, nope, not yet. But we are on live stream, so people are watching. Hey, will the newly opened businesses be required to post the public health notices in all major languages spoken or written in San Francisco? 15 seconds.
Oh, I don't know if they're going to be able to be required to post them in all languages, but they will be required to post them.
Okay, sounds good. Now we're getting ready to come back on ABC7.
7, 6,
5, 4.
3.
I thought we were going on.
All right, we are back on with San Francisco Mayor London Breed. We actually had a really interesting conversation over on Facebook Live during the commercial break. So in the future, catch us in both places. All right, go back and forth. I want to ask you this question. It's related, actually, to people. One person brought up, hey, Dolores Park, so many people there, crowding. And then another person is asking, are you going to enforce the masks more, and can people get tickets for not wearing them? So can you address those two issues, which is really one issue, which is protecting people?
And I get the frustration that people are having, but what I ask people to do is let us manage this. I mean, do your part. Do your part, socially distance, wear your mask. We have people in the hotspots like Dolores Park and Alamo Square and other places. We have folks who are going around. We've actually cited some people, and we've been trying to deal with this, and that's our goal, just like around mask wearing. The last thing we want to do is cite people. The last thing we want to do, of course, is arrest people. We're asking everyone to just comply. And then, honestly, everyone, police yourself. We are doing the best that we can. And we can't, in many cases, we can't control every last adult who's violating the rules. We, unfortunately, are going to have some people who are bad actors, and it is what it is, and we're going to continue to do everything we can to move forward. The fact that most people have followed the rules and complied is why we're in a good place, despite those people who are bad actors.
All right. Well, in terms of moving the economy forward, you've talked about how important it is to get widespread testing. So I want to ask you, how satisfied are you right now with the state of testing today in San Francisco?
Well, I won't be satisfied until we're at a point where we're at least doing anywhere between 1,600 and 1,800 tests a day. And that's really part of the 5 phases of our ability to reopen. Having testing readily available to San Franciscans, to people who live and work here, is critical to our ability to reopen and to continue to fight this virus. So that's my goal for the city.
But how many tests do you think you're doing a day right now if your goal is to get to 1,800?
We're doing over 1,000 right now, and we are well on our way to get to that point. That's, again, a really important part of our reopening criteria.
Are you convinced that at this point, anybody who wants a test in San Francisco can get one if they either work here or are a resident?
To be clear, anybody who's a resident who has one symptom, you have a cough, you have a fever, you have any symptom, call 311 or go to sfgov.org. We will sign you up and we will get you tested every time you ask, whether you have insurance or not, whether you're documented or not. If you are an essential worker, you don't have to exhibit any symptoms. You can call 311, you can go to SFGov, and you will be tested. So we have made testing very accessible, very easy. Today we opened up satellite locations in the Bayview Hunters Point. We'll open an additional place in the Bayview and the Tenderloin and the South of Market. So we're spreading out so that we can make testing easily accessible to people all over the city.
Okay, so you don't have to show an ID, right?
I don't. Do you? Yeah, I think you do have to show ID.
Okay, do you have to have an address?
I don't know. I
ask because, you know, what if somebody doesn't have an address because, let's say, they're homeless?
Oh, yeah. So basically what you do is when we have tested in many cases those particular individuals, we do list them as not having a place that they are housed. So we have to just make sure that you are either an essential worker or resident of San Francisco. And we're very flexible on that. We're not going to interrogate somebody. If someone needs to be tested, we're doing everything we can to test them.
Okay, Peggy Lee has a question for you on Facebook. She says, if there was any time to take people off the streets with hotels vacant and those businesses also needing help, this is it. Social workers would also be protected serving people who are able to self-isolate in that situation. If that time isn't now, when is it? What do you think?
Well, it's not true that social workers are able to be protected. The fact is we still have some of our shelters that are open. We still have social workers with their own maybe problems with babysitting or their elderly parents who are at home and they're not necessarily able to come into work. So it's more complicated than what it's being presented as. The fact that San Francisco's been able to help get over 1,000 people out of our shelters and in some cases people off the streets into hotel rooms, into trailers and other ways to provide support to homeless and many of the vulnerable homeless has been more than what most other cities has been able to accomplish. Not to mention in the age of social distancing is not as simple because we have to make sure that not only the staff, it's not just social workers, it's clinician, it's health professional, it's the hotel workers, it's the people who serve the meals, it's the people who clean the laundry. There's a number of people who are responsible for helping support these individuals in these hotel rooms and helping them to follow the social distancing guidelines, in addition to providing PPE for the residents and the people who are part of the workforce. So if it were that simple, we would have done it a long time ago. But I will say that the people who are working on this have done an incredible job with, in many cases, limited resources, shifting of staff, challenging environments. It is really been a big challenge in the city.
All right, Mayor London Breed of San Francisco, thank you so much for sharing news of new testing sites in different neighborhoods in San Francisco, and how are you going to look at the numbers to continue to assess when we can open things up. I really appreciate it. Good to keep the conversation going.
Thank you so much.
All right, take care.
All right, thanks.
All right, next we're going to hear from Dr. Alok Patel. He's answering your questions. Also this one, can sheltering in place lower your immune system? Lots of new developments on the medical front. Plus, sports director Larry Beal is going to join me to talk about the real chance of sports returning in a few weeks. So stick around.
We are in commercial break.
All right, commercial break. Today we have an action-packed show. So next we have Dr. Alok Patel. Let's take a look. Actually, Larry Beal dials in first. Great, we get to talk about, okay. We will talk to Larry about the news that Governor Newsom is saying we could have a resumption of pro sports in just a few weeks. So he's been checking in with the Warriors, with the Giants, and of course the Warrior season's over, but the players want to get back to practicing and training. So we'll talk about that. All right, so post your questions. If you have a question for Larry Beal with regard to sports reopening, whether it's the Giants, oh, I can't wait for baseball to return, or, you know, something else, some facet of sports returning, go ahead and post those questions now.
1 minute.
Some of these comments are cracking me up. People, you need to wash your hands. It's a very good point. Everybody needs to wash their hands, 20 seconds, right? How safe is the medicine? Oh, you're talking about hydroxychloroquine? Oh, right. That's another big piece of news today, that the president allegedly said that he does take hydroxychloroquine. It's a malaria drug, also, I believe, used for a couple other things. It's not a new drug, but he has long been touting that as a potential game changer for people with COVID. As far as we know, he does not have COVID. He is tested daily, so we'll be looking into that one. So, all right, we're coming back on air.
15 seconds. We are back in 10, 9, 8, 7, 6, 5, 4, 3.
And welcome back. There's been a lot of big news regarding reopening, moving into phase 2 in the Bay Area and statewide. So let's take a look at some headlines statewide from Governor Newsom just today. He said they've seen significant progress in the 5 indicators, meaning drops in topics like ICU, hospitalizations, testing, and PPE. He said 53 of 58 counties could see dine-in restaurants reopening soon, along with in-store retail. He said hair salons, churches, and sports without fans could happen in June, and he'll give more details in the next week or so. A lot of you are wondering about the sports angle. Of course, Mayor Breed just told us her best guess is 2 to 4 weeks to reopen things up like dine-in restaurants. So, that would be phase 2B. Sports, phase 3, is therefore not likely the first week of June like it might be in California. So San Francisco may have to wait a bit longer, but ABC7 News sports anchor and sports director Larry Beal joins me live now to talk about what we could expect. Larry, nice to see you a little bit earlier than usual.
Nice talking with you. I also had some nice conversations with people from the Warriors and the Giants, and everybody's excited. I mean, I think this is the first bit of good news that we've had in the sports world since Rudy Gobert tested positive for the Utah Jazz, and then the NBA shut down, and then everything pretty much shut down. Now, at least in the state of California, we have the door is ajar on June 1st, although you heard Mayor Breed say, not so fast. Right. We're not going to be ready in San Francisco. So I think this is going to take a little bit of time, but at least now we have some hope and some officials telling us this is the course that we are plotting.
So, Larry, I asked her if she's seen a plan from the Warriors or the Giants, or if her office is working with them to formulate the plan. And she didn't directly answer that, but I know you talked to the teams, and what have they presented? Have they offered up a look at what it could look like?
Well, Major League Baseball, they're in the process of going through this negotiation with the players' union. The owners, they gave them a 67-page proposal that includes constant testing. I mean, it's a whole new world for baseball as we know it. Just a few of the items: temperature checks, testing, no high fives, no seeds in the dugout, no spitting. If you get on base, you can't talk to the first baseman. Few players in the dugout, no fans, players in the seats spaced at least 6 feet apart. How about this? No showers after games. The idea is you play the game, hop on your bus, whatever transportation you're using, which can't be Uber or Lyft because that's not allowed either. Go back to the hotel, shower in your room, which probably will not have been made up because they don't want housekeeping coming in every other day or every day. So no meals unless you are socially distancing in the hotel, and you can't leave the hotel without permission. So that, I mean, it sounds almost like prison, but if you're making a few $1 million a year, it's a decent prison to be in. So that's baseball's proposal. I think each league is going to be far more extensive in their criteria than any of the cities are going to be, because the cities are not going to be this restrictive.
Right. Hey, I know the Warriors season is over, but I read something from Steph Curry talking about how it could actually be good for the fans in the sense that, if they're not in the arena, you can actually hear the conversation maybe going on from the players on the courts. Like, I don't know if that means trash talking or encouragement talking or whatever, but that could totally give a different aspect and a whole different feel to the game.
Yeah, absolutely. I mean, the Warriors have regular season games left on their schedule. It's not over, but it is over because they're the worst team in the league. And head coach Steve Kerr said just a couple weeks ago it didn't feel like they were ever going to come back this year, given their place in the standings and that the NBA might go straight into the playoffs. Now I'm hearing an amended version from the NBA that they might play a few games beforehand, but maybe not the 15 to 17 games that teams have left. In any case, what you're talking about, because the arenas are typically packed, let's say for a Warriors finals game, you got 18,000, 19,000 people, you can't hear anything from what the players are saying. But given the fact that all of these leagues are going to be playing, at least initially, without fans, if you have the players mic'd up, you've got a great opportunity to hear all of the trash talk, to hear what's going on the court, the stuff that we're all isolated from and love. I mean, if you watched any of The Last Dance with Michael Jordan, just getting all that behind-the-scenes video and these little clips that, I mean, we'd all, as sports fans, love to hear what's going on. And that may be one thing that the TV networks try to push for, and maybe the teams try to push for as well, to just get everybody back in. I mean, I don't think it'll take that much. The second there's a live sporting event on, I mean, I've got friends that were watching NASCAR that haven't watched one auto race in their lives this past weekend, but they wanted to see a live event, so they were there watching.
Okay, we're getting a hard wrap, so you know what that means. I don't have to tell you. All right, we'll take a short break on the air. One more question with Larry over on our Facebook live stream, so we'll be right back.
Okay.
And we're in commercial break.
All right, now we're in commercial break, and this is where you get that something extra with Larry. Let me see if there's a good question. If not, I'm going to ask another one.
Okay.
Let's see. Not all back. You still have to follow the rules. Nothing sports related. Okay, so I want to ask you then, given the profit, right? I mean, they can't lose money. If they don't have the fans in the stands and they're not making the money from that, to what extent are they still making money just from the TV and the stuff? Like, I don't know the breakdown, the percentage of where they get their revenue source from and whether it's still worth it.
So if you're the NFL, you can make money based just on your TV contracts, which are worth billions. They could play games in a TV studio and be just fine with no fans. Major League Baseball is a little bit different because so much of their revenue with 81 home dates comes from the fans, and part of the negotiation going on between the owners and the players union right now is over the financial restructuring of the game for this season. The owners have proposed a 50-50 revenue split, and they're claiming that they would lose hundreds of thousands of dollars per game if the players were to get the contracts as they are written today. So, I mean, it's hard to know unless you see their books, but I could see in baseball's case that it might not be profitable for some teams to go forward without fans. But at this point, I think there's going to be a major push just to get games going. NBA, they're almost into the playoffs, or will be soon. Even without fans, I think they would do okay. They're losing a lot of money in a lot of areas, but still, I think most leagues would just say, let's get the games going again.
Yeah.
When we can reintroduce fans, we'll be happy to do that whenever we're allowed to.
Yeah,
and it's safe to do so.
I can just see it now. The outfielder will be like, oh, I dropped that ball because, you know, the dude touched it. And I meant to do that.
Yeah, well, I mean, it gets complicated. I mean, how often do you change out the ball?
I know.
You know,
I'm told I got to let you go. So I'll see you in a half hour at 4, Larry. All right, we are back on air, and we are able to bring you even more content now that we have this new platform at 3 every day. That means we get more from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts and talking directly to you in a segment we're calling Doctor's Note.
The other day, I was outside and I heard someone yelling on their phone, "Sheltering in place weakens your immune system." Well, I'm Dr. Alok Patel, and let's explore this yelling person's claim about our immune system on today's Doctor's Note. We build up our immune system over many years, and part of this is exposures to the bugs and microbes living in our world. Some people believe that sheltering in place and being isolated at home would prevent these exposures and therefore weaken our immune system. Well, first and foremost, there is no scientific evidence to suggest that staying at home weakens your immune system because you're not getting enough exposures. We build up our immunity over many years, over decades, and this isn't exactly going to take a big dramatic hit from only a few months at home. And also, even while you're sheltering in place, you're still getting exposures to pathogens from groceries, from mail, from going outside. You aren't exactly living in a germ-free bubble. But there is something to be said about isolation and the effects on our immune system. And it's not about the reduced germ exposures. That doesn't make a difference. It's about the changes in our daily habits or our mental health. Stress, depression, bad sleep, changes in our health habits can all have negative effects on our immune systems. Now, you'll see people on the internet talking about and trying to sell immune boosters, but save your money. There are several things you can do right now to optimize your immunity, and none of these are really a surprise. Sleeping well, managing stress, eating a healthy, well-balanced diet, avoiding alcohol or cigarettes, getting plenty of exercise, and paying attention to your mental health are ways you can support your immunity. So please, skip the conspiracy theories and ignore all the internet salespeople. Take care of yourself, look out for others around you, Pay attention to the basic tenets of staying healthy, everything that you know you're supposed to be doing. And your immune system will thank you.
All right, that's going to do it for now. Thank you so much for joining us today on this interactive show, Getting Answers. And we got a lot of answers today. San Francisco Mayor London Breeze said her best guess is restaurants can allow dine-in here within 2 to 4 weeks. But data is going to dictate everything. That means sports without fans, salons and churches in San Francisco are more than a month away, is her estimate, so a little later than the state. Larry Beal says there's still a shot that the Warriors will play this season. So we'll see. We'll be here every day at 3. You can join us on air or on live stream answering your questions. Take care. All right. Thank you, Facebook friends. Thanks for joining today. I'll see you tomorrow.